Hi again, guys. It's Dr. Tim Newton with Inspire Movement Physical Therapy. In this video, we're going to show you a couple of strategies that you can use to safely lift, push, and pull and protect that shoulder joint. When you're thinking about how to protect your shoulder when you're lifting, pushing, and pulling, there are a couple of different principles that you want to follow. The first main one is to avoid the extremes of your range of motion. There are two main directions where your shoulder is very vulnerable. One is the high five position, where you're up like this. It could also be out like this, but you can sense the tensions already going into your joint being in the position. If you then add a load to it and try to lift or pull anything like that, you're asking for trouble. The other one is coming across like this. And really, anything where your arm is twisted inward is not a good position to be lifting. All right, we used to give exercises to strengthen the rotator cuff like this, and it was causing most patients pain. So we've moved away from that in physical therapy practice. You should apply that same principle to your day-to-day chores, right? The old lawnmower where you're pulling the string and going like that, that is a very, very strenuous movement for your joint. So generally, what do? You want to just try to stay in this mid-range. This is where your muscles are the most powerful, and this is where the joint is under the least amount of strain, where it's in the safest position. That's the first main thing that we want to remember when we're talking about protecting the shoulder. The second part is proper positioning of the scapula. And this is a very important thing, but it also has its subtleties. You want to make sure that you're pulling your shoulder blades down and back. Okay, so we talk about this in our scapular strengthening exercise video. You can check that out. But we talk about pulling down and back like you're pulling the shoulder blade, my left one, toward my right hip or my right back pocket. Okay, it's that down and back movement, but there's also a little bit of a rotation back of the top part of the shoulder when I do that down and back. It's not just a straight pull down and back, but there's also kind of a rotating. It's something that you need to go through with your physician or your physical therapist to make sure you're getting the muscle co-contraction just right. Specifically, we're talking about the lower trapezius muscle and the serratus anterior muscle. Those are the big stabilizers of the scapula. But basically, once you've gotten that movement down, you try to apply it to all of your different activities. If you are lifting something up here, you want to have your shoulder blades packed or set like that, right, in a good position before you lift up. And when you set something back down, you let go, and then you can let your shoulder blades go. But having the shoulder blades set by your muscles in that position to begin with is going to reduce the strain on the tendons and the ligaments of the shoulder joint itself. It should also go without saying that I'm demonstrating my lifting, again, here in this mid-range. I'm not out here. I'm not reaching out here. Do something that you can achieve and reduce the leverage by bringing whatever it is you're trying to lift, push, or pull in closer. The last thing that we want to talk about is pushing, okay? This could be when you're down on the floor, or it could be when you're pushing something forward. You just want to make sure that you're in this position, and you may even want to think of rounding your shoulders forward just a tiny bit before you exert that force. This is just a very special direction that has its own little rules. Again, this would be something that you'd be going through with your therapist, making sure that not only are you kind of down and back, but you're a little bit extra rounded, okay? This is very important if you add push-ups to your exercise regimen or any kind of plank. It's very important to have those muscles holding you with that back in a nice rounded position without winging of your shoulder blades. Okay, that's the serratus anterior muscle that we're talking about. So these are the basics, and you start thinking about wherever your arm is, just making sure that your shoulder blades are doing the right things, and you're also just being smart about avoiding those extremes of your range of motion. All right, everyone, so those are some safe shoulder lifting practices and mechanics that you can use every single day to protect the health of your shoulder. If you found this video helpful, don't forget to leave us your questions, your comments, subscribe, give us a like, and for more related material, check out our website at marylandmanualtherapy.com. Thanks for watching, and have an inspired day.